look at kind of their spend in relation to how it compares, kind of week to week, year on year, over the past years, and that helps us get some insight into trying to understand some of these questions about, is it increases in people, are there some billing issues? So we'd be happy to, come back and report about some of the other reports that we have out there. But that is something that we look at across the board, is just how the spend compares in relation to previous periods of time.
It will be interesting to know the findings of what they've done. I mean, we also had the case that keeps mentioning about managed care and behavioral health, or the coding issue that they were using that was substantially costing other states, but we're not hearing anything. I've never heard anything on number 2 or even number 3. But anyway, we have a question from Representative Sullivan and Representative Young.
Yes, thank you, Mr. Chair. Just to kind of follow up, Senator, on what the Senator was asking, I know when we do placements in various facilities, the highest cost is in the length of stay. Do we collect any outcomes? Because DHS is the largest referral producer in the state for whether it's kids in disabilities or RSPMI or nursing home. The state refers patients to those facilities. We're talking about the spend, but we don't talk about outcomes. Do we track any outcomes to make sure when we refer a patient to a facility that they have quality outcomes?
We do, in terms of looking at length of service and length of stay. I will say that is definitely one of the things that, as we've been moving forward on the reforms and the different transformations, particularly with behavioral health and developmental disabilities, those are some of the things that we're looking to increase as part of those packages that are making their way through the review and approval processes.
Now, I've been following this for probably 14, 12 years now. I've never heard of an outcome placement or any DHS patient in RSPMI or DD. It's always been what I've heard, and if you have the data that would suggest differently, I'd love to see the example of one placement that's been done based upon quality metrics. I'm not aware of any.
We can certainly go back and look. I think a lot of it depends on kind of how you define quality. I think as we've certainly, and I know we've worked in this area for a number of years, I think, we're going to try and strengthen that. I mean, that's certainly something that we've been working on, particularly over the past couple of years with the different transformation efforts. But, I think, inevitably we're always trying to find ways that we can be more efficient, be able to support, quality placements, and really looking at what's in the best interest of that client.
And I think, Senator, one of the things you brought up was managed care. It's one of the things that managed care can really bring to the state is placements based on quality. Right now, I think we missed that mark quite a bit. And I think this provider-led managed care, I've been a part of that. That's a critical component in savings, is referring patients at all those levels to facilities that have quality. But let me go a little bit different direction. When I heard you talking about these areas, I really heard a couple of different, I'm concerned about the trend, and the Senator brought that up too. We have a spending trend that's going up. We have a trend in our tax collections that's going down or flat. And I'm interested, we have all these different programs, and I'm interested, I'd love to see a trend line on those different programs that show what our trend is on those programs. My concern is that we're making significant cuts in programs that are already trending flat or trending down, and we're continuing to make cuts in those. But some of our areas are, particularly the Medicaid enrollment, is trending up very quickly. And I wonder why we would put the restraint on programs that are trending down or flat without putting any restraints on programs that are trending up quickly. And I think that kind of got back to the questions we were asking Department of Finance. They're saying you guys are the ones that control the spending. They're sending the money there. I just love to see a trend line on those programs. Do we have one?
I believe some of that information, if not all of that program, is in the financial outlook, and so we'll be happy to share that. It does give you a look back over the past 5 years around trends both with regard to enrollees in terms of as we've had new people come into the program, the breakout of that, by different groups in terms of is it children, is it adults, and then also looking at spend across some of these.
And I think that would be very helpful. I could read the numbers. I'd love to see that line go across what our state is collecting, what our state is spending, and then where those different programs, because if we're trending down or flat in some of our programs, and we're continuing to cut them, and we can project that spend out, so maybe we just don't look till 2017, but we look out to 2020 or 2025 where that spend is, and just see where because we got some going way up. That's all I have, Mr. Chair. Thank you.
Okay. Representative Mayberry.